Kadri idadi ya maambukizi inavyoongezeka humu nchini, ndivyo idadi ya vifo pia inazidi kuongezeka. Huku Kenya sasa ikiwa na watu wapatao 122 ambao wamethibitishwa kuwa na virusi vya corona.
In the last 24 hours, we have managed to test a total of 362 samples, out of which 12 people have tested positive for coronavirus disease. Out of this number, 11 are Kenyans and 1 Somali national. This now brings the total number of those who have tested positive for the disease in the country to 122. To date, we have managed to test 1,433 samples from individuals currently in quarantine facilities. We are now remaining with 617 individuals to be tested.
Inadaiwa kwamba mwenda zake mwenye umri wa miaka 6 alikuwa amelazwa katika hospitali kuu ya Kenyatta ambako alikuwa akipokea matibabu dhidi ya ugonjwa tofauti, na ilibainika tu kwamba ameambukizwa virusi vya corona baada ya kufariki.
Regarding the 6-year-old who died in Kenyatta National Hospital, of course, the necessary infection prevention control measures have been put in place, including quarantining of the staff that handled this particular deceased child. We have also been in contact with Kenyatta to ensure that that particular place has been disinfected and all those patients moved elsewhere. We are in the process, of course, of testing them because, you know, people who are in ICU, in terms of risk profile, they are at a very high risk of contracting COVID.
Daktari Mwangangi anasema kwamba aliambukizwa wanatoka katika kaunti zifuatazo:
Kiambu 1, Laikipia 1, Mombasa 2, Nairobi 7, Nyeri 1.
Vile kati ya walioambukizwa 8 miongoni mwao ni wanaume, huku 4 wakiwa wanawake.
9 of the confirmed cases were detected in the designated quarantine facilities, while 3 are from suspected cases admitted in isolation units in various health facilities. The ages of the confirmed cases range between 28 to 68 years. We have so far monitored 1,721 contacts, and out of this number, 1,073 have been discharged. Currently, there are 648 contacts that we are actively tracing.
Based on our calculations, that is about 25 to 30% of the cases that we have so far are local transmission. Local transmission occurs in forms of clusters. And these clusters, if they are not controlled, then they merge into bigger clusters, the so-called snowballing effect. And that is why we are really very, very firm on contact tracing, to be able to ensure that if you have any evidence of local transmission, then we go down to the area where this has been reported, make an appropriate contact tracing process to be able to ensure that everybody is brought on board.
Gloria Milimu, K24, Weekendi.